that out, I guess, in the coming hours.
Okay, here is the Prime Minister of Canada on this Good Friday.
Whether you mark Good Friday or Passover, Easter, Tamil New Year, or Vaisakhi, usually this is a time we spend together. You might go to church or to temple or to volunteer. Last year, when I served a community lunch in Hamilton, I saw just how much people come together over these next few days. But right now, this weekend is going to be very different. You'll have to stay home. You'll have to Skype that big family dinner. And the Easter egg hunt, well, it'll have to happen around the house instead of around the neighborhood. I want to take a moment on that to have a word with kids out there. The Easter Bunny has a big job to do this year, and maybe there's something you can do to help. Ask your parents to let you put up a picture in the window to bring some extra chocolate for nurses and doctors. They need a lot of energy to keep us all safe, and this is how you can help them to do their job. Peu importe notre âge,
whatever our age, we all have a role to play to counter coronavirus. Earlier this week, I mentioned that Health Canada had launched a call to volunteers to come and help our frontline workers. And already, more than 27,000 people have registered to help out and give them a bit of respite. From right across this country, there are many of you doing your part, and I want to thank you for that. You're there for each other, and I know that together we will come through this difficult time.
But you don't have to go through them alone. If you've lost your job and are having troubles making ends meet, you can apply for the Canada Emergency Response Benefit. Millions of people have already had their claim processed, and they're getting their $2,000 deposit. Remember, you can apply today or this weekend if you haven't done so yet by going to canada.ca or calling 1-800-959-2041. If you own a small business and are struggling to pay the bills or pay your staff, we launched the Canada Emergency Business Account yesterday. You can now get a $40,000 interest-free loan through your bank or credit union. And if you repay it within 2 years, 25%, up to $10,000 of that loan is forgivable. It'll only take a few days for you to receive the full amount in your account. That's money you can use for whatever you need, whether it's monthly expenses or paying employees. On that note, we're getting closer to implementing the wage subsidy, too. We're working with other parties to get this in place as quickly as possible. Tomorrow, we're bringing back the House of Commons to pass the largest economic measures Canada has seen since World War II. It's really important, despite a time of crisis, in fact, because of a time of crisis, that our institutions remain strong and our democratic principles continue. Therefore, this address to Canadians tomorrow will be a little later and from the floor of the House of Commons. And on that note, I'll be taking Sunday and Monday with Sophie and the kids, but I'll be back Tuesday with more updates on how we're helping you. If you just feel overwhelmed, we'll soon have more to say about how you can access resources that can help. If you're in crisis, reach out, lean on each other, and know that we will get through this together. All across the country, there are stories of people stepping up to do their part. To ensure that Canadians are safe and our frontline workers have the support they need, we're helping companies join in the effort. Look no further than Fluid Energy from Alberta. They will produce over 1 million liters of hand sanitizer each month, with shipments starting as early as next week. We've invested in this large-scale production as part of our plan to have enough vital supplies produced right here at home. When Canadians work together, we get things done.
Last night, I again had a discussion with the Deputy Prime Minister and the Premiers of the provinces and territories. Right from the beginning, we saw a lot of people join Team Canada, including the Premiers. We are all on the same wavelength, and we are all working together to ensure your safety. Over the long weekend, we will all have to remain at home. We cannot have people over for dinner, and we will have have to be creative in organizing an egg hunt and staying inside. But not just because we're separated physically doesn't mean we can't lean on each other. You can organize a dinner on FaceTime, and if you can, make a donation to an organization. During the Easter weekend, this will be different than usual, but I know it will be filled with joy, laughter, and love. Thank you, everyone.
Thank you, Prime Minister. We'll now open the floor for questions. You can go to the phone line. One question, one follow-up. Operator.
Thank you. Merci. First question, Mike Blanchfield, the Canadian Press. Line is open.
Good morning, Prime Minister. Happy Easter, and whatever else is on your plate. G20 energy ministers are meeting today, as you know, and I'm just wondering what Canada's plan is for playing its role with other countries in the G20 after what OPEC did to cut production and to try to boost oil prices. What's Canada going to be doing?
Canada is part of the discussion, obviously, with the G20 energy ministers. Minister O'Regan is sharing our perspective and the challenges that we're going through in Canada, from Newfoundland to Alberta and Saskatchewan. We're going to continue to work because we recognize that this is a global challenge for many, many different countries, and having a concerted approach is extremely important. We noted what the OPEC countries did yesterday, and I know that's going to be a subject of discussion at the G20 energy meetings conversation today. Okay. Nous faisons partie de cette conversation
are part of that conversation with the Energy G20 ministers. Yesterday, we did note what the OPEC countries made as a decision, and those discussions are continuing because Canada is very seriously affected by the oil production issue.
Follow-up.
Prime Minister, so what do you see Canada doing? Do you see it cutting production along with these OPEC countries? If so, what effect would that have in Canada?
As we know, Alberta has already curtailed production and has for some time now. We're going to continue to look to make sure that other countries are doing their part and that people understand that the most important thing through this is to ensure that families and workers across the country and indeed around the world are getting the support they need to get through this crisis safely.
Next question, operator.
Thank you. Merci. Prochaine question, Marie Vastel, Le Devoir. À vous.
Good morning, Mr. Trudeau. I'd like to come back to the conference call you had with the provinces yesterday. There was consultation about the possibility of invoking the Emergency Measures Act, and I gather this would be to ensure the distribution of PPE across the country. But last week, you said that the provinces could share that equipment and that the provinces had agreed to send that equipment to the provinces that needed it most. So I understand now that the cooperation between the provinces is not going so well. Is that correct? No, I can tell you that the cooperation continues and is improving between the provinces. We really see that this is an historic moment where all the provinces and territories are working together. And when it comes to the Emergency Measures Act, it includes fairly stringent requirements in terms of consultations, and we are following that act and looking at the situation in case we have to invoke that legislation. Now, at this time, we do not need it, and we hope we won't need it. But the way our country works is the provinces have emergency measures acts that they have enacted, and if those acts do not suffice, the federal government has its own legislation that can be added on. But for the time being, that is not necessary, and we all hope that it will not be necessary. As a follow-up, this Emergency Measures Act, still with respect to supply problems, could it allow you to centralize the procurement of PPE and increase your buying power in that way? And might that not help us to avoid the problems we're experiencing now? When we're talking about supply, supply is not an issue in terms of the cost or the buying power. The costs are going up. But the reality is that the provinces and the hospitals have their own connections to producers right around the world, and they are using those contacts and connections to secure the equipment they require. In addition, of course, to all the other efforts that are being made right across the country. So it's not a bad thing for everyone to be doing what they can. Of course, we must ensure that we are coordinating our efforts and we're aware of what's working and how things are working. So it really is a coordination effort that we're making at this time, and there is a tremendous amount of cooperation, and that's why we do not need to invoke the Emergency Measures Act at this time. That cooperation is already very strong.
Thank you. Next question, operator.
Thank you. Merci. Next question, Steve Shear, Reuters. Line is open.
Hello, Prime Minister. Good morning. There's a story out today saying that the Bank of Canada Governor Paulos was not asked to extend his mandate, and I was wondering, I know there's a selection process in progress and that it's not over, but ultimately it is the government that decides. I'm just wondering if you think it makes sense for the current governor to stay on a bit longer to help underpin confidence during this crisis. Thank you.
This is an extremely important question because we know the important role that the Bank of Canada has in leading on monetary policy that is an essential part of our handling of this economic crisis related to COVID-19. The government has many fiscal measures, but a strong Bank of Canada is essential in getting us through this as well. And Governor Paulos, as always, has done an extraordinary job and continues to do an extraordinary job. The process is ongoing and decisions haven't been made as to what the next steps are.
We recognize that it's extremely important for the Bank of Canada to be able to play a central role in Canada when it comes to responding to the economic challenge of COVID-19. Governor Paulos is an extraordinary man, and he has always done an excellent job and is showing even more excellence in these times of real challenges. In terms of his successor, no decision has yet been made.
Follow up, Steve?
Yeah, if I could just follow up, can you give us an idea when that decision might be made?
The discussions and reflections are ongoing.
Thank you. One more question, please, operator.
Thank you. Merci. Prochaine question, Catherine Lévesque, La Presse canadienne. À vous.
Good morning, Mr. Trudeau. Just to come back to the Emergency Measures Act, I'm wondering under what circumstances would you need it? Well, there are various scenarios that we've already discussed with the provinces, whether it's in terms of challenges involving supply of equipment or limiting Canadians' movement even further. So there are various measures that we could theoretically consider, but those measures are not necessary at this time. And for now, the provinces and territories can make their own decisions and introduce the measures that they need. The tools that the federal government has right now, such as the Quarantine Act, mean that we hope we won't have to use the Emergency Measures Act, and certainly that would be our preference.
I think there are a number of tools that the Emergencies Act provides for, much stronger controls on distribution of necessary medical supplies and equipment, for example, or further restrictions on travel or on Canadians' freedoms. But as I said, the way our country works is that provinces have Emergencies Act that they can bring in with very strong measures that they have all done. If at one point those measures are insufficient to do the things that are needed to do, and all the tools that the federal government has at its disposal are insufficient to bring forward measures that are deemed necessary, then and only then do we consider the Emergency Measures Act. But as I've said, it is our hope that we don't have to use it ever. We are seeing that the collaboration, the partnership among provinces and territories, and the way we're moving forward on this means that we might not ever have to use the Emergencies Act, and that would be our preference.
Yes, it's been almost a month that your government developed its first measures to address COVID-19, and I'm wondered whether you have already taken some lessons from the last month. Well, in recent months, what we wanted to do was move very, very quickly in order to create new methods and new programs to deliver aid to a huge number of Canadians. Now, certainly our ability to do that was tested in recent months and in these recent weeks. But we have been able to do a great deal to ensure that Canadians this week will be receiving help. But at the same time, we recognize that every time we want to move quickly to help as many people as possible, as quickly as possible, there are always some things that need to be improved, and that's what we're working on now. But I think it does show that our public service is extremely resilient and can deliver in very difficult circumstances for all Canadians, and that will give us greater comfort in terms of being able to bring in additional measures that are appropriate and maybe new as well. But as I say, we've shown that we can respond quickly when the need is there.
I think one of the things we've learned over the past month is that when it needs to, government can move very quickly to help Canadians. We've seen the money from the CERB flow last week into Canadians' bank accounts across the country. That was a monumental task for our public service, for hardworking Canadians across the country who make sure that they are serving Canadians with the best that they have. And I think that lesson that when it's necessary, we can move very, very quickly and nimbly as a government is one that should inform reflections of a government going forward.
Prime Minister, Rachel Haynes here from CTV National News. You've said a number of times that testing is an essential way to flatten the curve, and you spoke to Premier Doug Ford yesterday, who has also pushed for more testing in Ontario. But at the same time, we do know that there still remains a number of shortages when it comes to testing kits. How long will it be until every person who needs a test right now is able to get one?
We are continually ramping up our testing. We started earlier than other countries in terms of intensifying our testing programs. Certain jurisdictions are doing extraordinarily well on testing, like Alberta and British Columbia. Quebec is coming a long way very quickly, and Ontario is addressing some of the challenges that they've faced over the coming days. We know there is more to do, but we can certainly know that the lead that we've taken on testing is part of why we are seeing a flatter curve than other places. We've done significantly more tests in total than the United States has, and they're 10 times the size of us. So we know that Canada's testing regime has been good, but absolutely can get better, and we're going to continue to develop more testing kits, faster testing, because we know that even as we get through this first wave of COVID-19, once we are able to get into those coming months where we will be on guard but not as shut down or paused as we are right now, testing rapidly and efficiently of as many people as possible will be a key part of that path forward. Okay. Nous avons fait énormément de progrès en matière de
made a huge amount
dépistage au
of
cours
progress
des
in
dernières
terms of
semaines.
testing
On
over the
savait
last
dès
few
le
weeks,
début que
and we knew right from the beginning
dépister le virus
that
était
testing for the
essentiel
virus was a
comme
critical piece
stratégie pour
of our
restreindre
strategy
la
to
propagation
limit the
de la
spread of
COVID-19.
COVID-19.
À tous les jours, on
Every
améliore
single
nos
day,
protocoles
we're
de
improving
dépistage.
our testing
La
protocols.
Colombie-Britannique et
British
l'Alberta
Columbia
font
and
très, très
Alberta
bien en matière
are
de
doing very
dépistage.
well when it
Le
comes to
Québec
testing.
s'est beaucoup
Quebec
amélioré
has
au cours
made a lot
des
of progress
dernières
as well
semaines.
and
Et
improved its
l'Ontario est en
testing
train
in recent
d'adresser
weeks.
des enjeux
And
réels qu'ils ont eus
Ontario
avec
is
leur
now
programme de
addressing
dépistage.
some problems with
On
its
sait qu'il y a
testing
plus
program.
à faire et
So
on va
we know that
continuer
there's
à en
more
faire
to
parce
be
que ça
done,
va
and we will continue to do more
ça va être un élément
because that
essentiel
is a critical part
comment on va
of
pouvoir
our
passer l'année à
ability
venir sans
to
avoir
get
les
through the
restrictions
following
qu'on a
year without the kinds
actuellement,
of
mais
restrictions
en ayant la
we're under
capacité
now,
de
but also
limiter,
having the
d'autres
ability
propagations,
to
du
limit
virus.
further spread or
testé
outbreaks
beaucoup
of the
plus
virus.
déjà
We
qu'aux
have already
États-Unis.
tested
Ils ont
far more
qualifié à
people
10
than
fois
in the United
la
States,
grandeur
even
de
though
notre
they are
population.
10 times
Mais
larger than
ensuite,
Canada in terms
faut
of
encore faire.
population.
On va
But we
continuer.
know we have to do more, and we will.
And over the past few weeks, you've made a number of announcements about Canadian companies and retooling facilities in order to ramp up domestic production. And you just said in one of your previous answers that the government can move quickly when it needs to. But there are still a number of Canadian companies who say that they can supply this medical equipment, but they're either getting caught in red tape or haven't heard back from provincial or the federal government. So how long will it be until these domestic supplies make it to the front lines and into hospitals?
We've had thousands and thousands of Canadian companies step up and offer to be part of supply chains for essential services, for essential equipment and medications. We are working with all of them as quickly as possible. There have had to be choices as to who we could move quickest with, who was furthest along, but we will continue to work with all companies who put up their hands to be helpful, to figure out ways they can best help. This is something in which all Canadians can pull together and are pulling together, and we will continue to do that.
Hi, Prime Minister. Crystal Logue with Global News. Is the federal government considering any measures, such as regulation or federal oversight, to ensure long-term care facilities are protected from this or future pandemics?
There have been a number of reflections and discussions on this. We've seen that British Columbia has taken strong steps to ensure the safety of long-term care workers and residents. Obviously, this is a point of vulnerability, as we've seen throughout the country in terms of the impact of COVID-19. We're continuing to work with health professionals and medical experts to make sure we're doing everything we can to protect our seniors. Okay.
We recognize that long-term care homes and seniors' homes are a point of vulnerability for spread of COVID-19, and particularly for our seniors and the people who work with them. And that's why we are looking at a number of proposals, including some from British Columbia, to ensure that our seniors are as protected as possible during these tough times.
A number of healthcare workers are contracting the virus. Is that a concern for the federal government, and what is being done to help protect them?
Of course, we are tremendously worried whenever a healthcare professional contracts the virus. That is why providing adequate and significant amounts of personal protective equipment, making sure that protocols are being followed, helping provinces adjust their medical systems in ways that protect our healthcare workers is absolutely essential. We need our healthcare workers not just to stay healthy for their own benefits or the benefits of their families, but we need them to be able to stay healthy for the benefit of our entire community. But we also need them to know that we have their back as they don their protective gear, as they go into battle against this virus for the rest of us. We need to make sure they are getting all the support they need, because they are the ones that are going to save Canadians. Okay. Nous reconnaissons à quel point c'est essentiel.
We know it is absolutely essential to give all the support and help and equipment possible to our healthcare workers. That's why we're working very hard to give them that equipment and to coordinate our approach with the provinces and working with the provinces and territories as to how they feel they need to protect their healthcare workers and their system. We know that they must be protected not only for themselves and their families in order to protect us, but they have to know that we're there for them. They are the ones on the front lines of this fight, and they are the ones putting themselves at risk to keep us safe. So we have to be there for them, and we have to ensure that they can continue to do the extraordinary work they are doing now for us.
Good morning, Prime Minister. Salima Shivji, CBC News. A briefing note prepared for your Minister of Health on March 10th actually said that the risk of the spread of the virus within Canada remains low at this time. How do you explain the misinterpretation of the threat of the pandemic at such a late stage?
I think we saw that within days we'd begun to take very serious measures to restrict travel, to encourage social distancing. We moved very quickly and earlier than some countries on countering the potential spread of the virus. At those days, the numbers of Canadians infected were still low, but we saw the potential that we are in right now, and we started to act early. And that's why the measures that we're taking right now, the significant measures that we're in right now, are keeping us, we are hopeful, on the best possible curve to get through this in the coming months. Okay. Nous avons reconnu que ça commençait à devenir.
We realized that it was becoming more and more serious and that there was a potential for a greater impact across the country. And that's why we acted quickly to limit people's movements and encourage people to practice social and physical distancing. We took significant measures which did ensure that the impact in Canada was slower and not as serious as in other countries, and we will continue to take whatever measures are necessary to ensure there is the least impact and the shortest impact thanks to distancing.
So was that advice that there was a low risk of the spread of this flawed, and what impact did that have on your government's work to contain the virus?
Our work continued every step of the way, informed by the recommendations made by our health officials. We wanted to both make sure that there were no panics on Canadians, while at the same time getting people to take more and more significant measures, because we knew that the behavior of Canadians was the strongest way of doing what we've been able to do so far, which is slow the spread of the virus, delay it beyond where it's been in other countries, and give us the best possible chance of getting through it. As we look back, of course, there's going to be things we said, oh, we might have said this differently or that differently. There's going to be an awful lot of learning through this. But it remains that as we get through this now, as we live through the measures that we've put in place and lean on each other and hold together, we have the best chance of getting through this in the coming weeks and months by remaining true to the advice that experts are giving us, to stay home, to keep 2 meters apart, to wash our hands regularly, to not go outside unless we absolutely have to hunker down, lean on each other virtually and metaphorically, and be able to support each other through this time. We
recognize that, of course, we may think we should have done this or should have done something different, but the reality is that we took measures quickly that ensured that the spread of the virus would not be as serious as in other countries. We are still on a path that should allow us to come out of this pandemic more quickly than other countries, but we must continue along along the path that is in place now. Stay at home, maintain the right distance, and not go out unless we need to. Wash our hands frequently. These are the things that will ensure that we can get through this as best as possible and rebound economically and as a society as quickly as possible. Now, with respect to the economic impact, now the Premier of Quebec was saying that some economic sectors will be able to start up soon. But you're saying it's going to be a year or a year and a half before we get back to normal. Do you believe that there are some economic sectors that can start up sooner, and if so, which ones? Well, we cannot talk to a return to normality unless there is a vaccine or until there's a vaccine against COVID-19. However, there will be some relaxation of restrictions once we have come through this first wave of contagion. In our models, we can see that that relaxation could possibly start this summer. But even in the fall, we will have to live with certain measures or restrictions to keep us safe and minimize the risk of a resurgence of COVID-19, which means that we will not go back to normality, to the previous situation before COVID-19, unless or until there's a vaccine against the virus. But there are various sectors of the economy and certain economic activities that can start up again once we've completed this first wave. And we are currently discussing that with the provinces and the industries and healthcare experts and our scientists, so that we can determine where and how we should relax the restrictions and how to do it gradually. So I agree with Mr. Legault that we should be able to do that in the weeks and months to come. But we have to reflect very carefully and in full coordination with others as to how that can happen. I think it may have been a little discouraging yesterday to hear you say it would take a year or a year and a half before we return to normal. Could you be more specific and perhaps talk about which sectors could start up again? You're talking about measures that could be in place for a year or a year and a half. In concrete terms, what are you talking about so that people can know what to expect in the coming months? We are currently in the first phase of the virus. We are dealing with the spread of this virus right across our society, concentrated in certain regions, but we are all vulnerable to COVID-19 at this time. So we are taking steps now to ensure that people stay home in order that people don't go to work unless they have to ensure that people don't go out unless they absolutely need to, and people are fully aware of the situation we're dealing with now. We basically have paused our economy and paused our normal life as Canadians, and we will have to continue to do that until we come through this first wave of COVID-19 that should be the most serious. Now, once we've come through this first wave, we will be in a place where we can relax certain rules. More people perhaps can go to work. Maybe schools can start to open again. Some economic activity can begin. But this will have to be done in such a way as to minimize the risk of further outbreaks of COVID-19. At that time, we will have developed much better testing protocols, for example. We will have the technical and technological ability to follow or do the contact tracing of those who have been infected. We will be in a much better position at that point to limit further peaks of the spread. And it won't be normality as we knew it before, but we will be able to do a great many things that we cannot do right now, even though we'd like to. But there will be ongoing vigilance until we have a vaccine that's distributed to everyone, and we don't know when that will be. It could take 6 months, it could take a year or a year and a half. We don't know how much time that will take. But in the meantime, our researchers are working on that very hard. But what we do know is that our ability to ensure that this first wave of contagion finishes this summer depends entirely on us, on the citizens of this country, on people continuing to stay home, on people continuing to maintain their distance, on continuing to do what we're doing now for a number of weeks. And then possibly we can, and I hope to be able to talk about relaxing the current rules in the summer.
What we are in right now is the first phase of the spread of the virus. This is the phase that runs to a certain extent unchecked or difficultly checked through our society, through our communities. We're seeing new cases pop up here and there. We're seeing people struggle to handle it and to keep these measures from overwhelming our healthcare system. If we do things right, this will be the first and worst phase that we go through as a country in terms of COVID-19. If we keep these measures, these strong measures in place of staying home, of not going outside unless we absolutely have to, on keeping 2 meters apart, in being strong about social distancing, these are the things that will ensure that we will get through this first wave of the virus as quickly as possible with minimal loss of life as well. This is what we're looking for, of not overwhelming our healthcare system. And that happens if we stay strong about remaining at home for the coming weeks. According to the models we've put forward, it is possible that we will be able to be out of that wave this summer. And at that point, we will be able to talk about loosening up some of the rules that are in place, looking at particular sectors where people can go back to work, bringing in new rules around how people can interact with each other in society and get things rolling again. We'll have to be very careful about how we do that, and we will have to remain vigilant and active every single day for possible resurgences of the virus. At that point, however, we will have developed much better testing protocols, because every single day we're improving them. We will develop new technologies for contact tracing, and we will all become much better at reacting when a possible resurgence happens. So as we look at possible resurgences over the coming months, we will be better adjusted and adapted as a society to minimize them, and therefore minimize the disruption to everyday life, to our economic activity. That is the ideal scenario. But it only happens if we continue to stay strong for the coming weeks and stay, inside, keep those 2 meters apart, and be very careful about not allowing COVID-19 to spread further. That phase of vigilance, of easing off to a certain extent but still being careful, will continue until such a time as we have a vaccine for the virus. Researchers across Canada and around the world are working hard on this. It could take as little as 6 months. More likely it'll take a year or a year and a half, maybe even longer, but I know the best minds are working on that. So we will, once we're through this first phase, be able to get back to something that is more normal, but we will not get back to the normal that we had before, at least until we have developed a vaccine for the virus. That is the reality, but the fundamental bottom line that people can reflect on this weekend is, if we stay strong in our social distancing measures now and for the coming weeks, we can see how things can start getting back to normal in the coming months, and we will be able to get through this, because that's what Canadians do. We lean on each other, we support each other, and we figure out how to get through the big challenges that life throws at us. Merci beaucoup tout le monde. Have a wonderful Easter.
All right, that is the Prime Minister of Canada.